Welcome to our live webinar titled Living with Bone Marrow Failure, Stress Management and Survivorship. Thank you for joining us. My name is Alice Hauk, Senior Director of Patient and Professional Services at AAMD-SIF, and I will be moderating the presentation today. As we get started, we recognize the generosity of our corporate sponsors and the generous support of patients, families, and caregivers for supporting the webinar today. Due to the high volume of teleconferences on the internet, it is possible you may lose your connection during the webinar. If you are unable to view the webinar online, you can call in to hear the audio portion of the program using the call-in number in your reminder email. Today's program will be archived to our website within 2 to 3 business days. You will be notified by email when it is live and ready for viewing. Immediately following the presentations, there will be a question and answer session. Please feel free to submit questions at any time during the presentation. To submit a question or comment, open the Q&A window on the lower part of your screen, type your question in the small text box window, and when you have finished typing your question, hit enter. We will do our best to get to all questions. When asking questions, I respectfully ask that you do 2 things to help us manage incoming questions. First, submit your entire question all at the same time. Second, please do not share private health information in your question. Our speakers cannot answer any specific questions related to your health care. Today's specialists are Elyse R and Areej El-Jawahri. Dr. Parks is a clinical health psychologist and health services researcher who focuses on understanding and improving health-related behaviors. Her research interests extend across physician and patient behavior change, the role of culture on cancer preventive behaviors, and resiliency among cancer patients and providers. Dr. El-Jawahri, an oncologist specializing in the care of patients with hematologic malignancies and those undergoing hematopoietic stem cell transplantation. As a clinician, she takes care of patients with acute leukemia, myelodysplastic syndrome, chronic leukemias, lymphomas, and myelomas. Her research interests include investigating patient-reported outcomes, enhancing patient-centered decision-making interventions, and designing supportive care interventions to improve the care of patients with hematologic malignancies, with a special emphasis on patients undergoing hematopoietic stem cell transplantation. With that said, welcome Dr. Parks and Dr. El-Jawahri. Dr. Parks.
Thank you so much for inviting us to be here. I think Dr. El-Jawahri and I will spend a few minutes on our presentations, and we'd love to open it up to Q&A to hear about the folks who are in the audience per se. So I am a clinical health psychologist. I've been at MGH for 22 years, and one of my clinical specialty is working with individuals post treatment for curative intent, or individuals who are living with cancer. And so what I'd love to do is just talk a little bit about, though, the experience of living with an illness and some things that we work on clinically with patients, individual or in groups. I'm having a little bit of trouble with my screen. Can you see the notes, or are you seeing the slideshow view?
We're seeing the notes view, Elyse.
Okay, don't know why that's happening.
If you're able to go into slideshow, if you press escape.
I did. It's unusual for me this to happen if I just have one screen. So okay.
Maybe if you click at the top and slideshow.
There it is. Okay. How's that? Is that better?
Yeah.
Better
Looks
for me.
good.
Okay, great. Thank you all so much. So thank you for inviting me to be here. So I'm going to just speak for about 15 minutes or so about some just take homes that we impart with patients, again, in individual group setting. One of the things I talk about is the lens of an illness, whether it's cancer, bone marrow failure, post cardiac events. People's often the lens of their lives change, and so you see things that you didn't see before, pre-existing problematic relationships or health issues that were there before, kind of emerge in a very different way. And on the other hand, There are things that you hadn't seen before, special relationships and appreciations for things that you now see. And so I always encourage people to think about that kind of two-way mirror in their lens. Some things are problematic, but some things are also promising. The important thing is that you need to be looking on both sides of the lens, the first side prior to your illness and the other side after the illness. One of the things that we've all learned to deal with in the past couple of years is uncertainty. And there's a lot of parallels to all of your illness experiences and really what the world was going through in terms of the uncertainty of the pandemic. What I found in my experiences with some patients is, ironically, patients like yourselves who live with uncertainty, actually, I think felt a lot of them had a sense of agency in this period of uncertainty, that this was to them their new normal in many ways, and that they had a lot of skills for coping with uncertainty, whereas other individuals who had not had the same type of illness uncertainty struggled a bit more. So on the one hand, this period of uncertainty the past couple of years have been filled with a lot of anxiety and expectation and lots of expectations of concern. On the other hand, there's also a lot of promise and a lot of ability to kind of cope and go with the flow in the face of uncertainty. We talk about resiliency at our work at the Cancer Center, at the Mind Body Institute and MGH. We define that resiliency as the ability to adapt successfully, to bounce back in the face of stress and adversity, like the pandemic. And since many of you have been coping with ongoing health issues, if you look within, I bet you'll be surprised to see how much bouncing you're able to do compared to family members and loved ones who have not had this type of adversity. One of the quotes we used during the pandemic is Viktor Frankl, who is a Holocaust survivor's perspective lens. When we are no longer able to change a situation, we are challenged to change ourselves. And that's, again, looking at that lens of illness and looking at the positive side of it. How can you challenge yourself to change yourself, challenge yourself to learn from your illness experiences? In our resiliency framework, we work with people to think about how to respond to stress. So what we define responses as one's ability to maintain adaptive functioning in the response to chronic ongoing stress of daily living. So that resiliency is learning to deal with the day-to-day stressors, the uncertainty of traffic on the way to a doctor's appointment, the uncertainty of symptoms post-treatment. And how is one able to cope successfully and feel adaptive and feel a sense of agency in this day-to-day coping? We have coined over 100 years ago, Walter Cannon, who was a physician at Harvard Medical School, coined the flight or fight response, which was in response to an adverse event, someone would either choose to fight or flee. We've also recently added a third F, which is freeze, is when one stops being able to respond. This is a chart called allostatic load. Allostatic load is the wear and tear that you face when your stressors outweigh your coping abilities. The pink line is allostatic load, which is normal and quote unquote healthy, in which a stressor occurs, you adapt, another stressor occurs and you adapt. Allostasis is when you are, the allostatic load is when each time you try to adapt, the stressor rises and rises and you have challenges adapting to it. My dog, now I am feeling a little allostatic load because my dog seems to be asking for attention now that I'm focusing on all of you. Allostasis is the balance when one's stress and one's stressors are matched by their ability to cope with stress. So allostatic load, that wear and tear. Allostasis is what we're all trying to work toward. One of the things I want to say in terms of stress that we often also emphasize with patients is that stress is kind of like an elastic band. So too much stress, which a lot often experience in the form of coping with an illness, makes the elastic band too taut and ready to snap. But not enough stress is a bit flaccid and boring and unchallenging. So the question is, what is your allostasis and what is your tolerance for level of stress? And I'd love for you to think about if that tolerance has improved over time as you have learned to cope with your illness. These are different examples of allostatic load and allostasis. This is the allostasis, the normal one has an elevated stress and they recover. This is an example. The next one is an example of kind of hypervigilance, that every time a stressor happens, you go from 0 to 60, but then you return to your normal level. This is a prolonged response where someone experiences stress and they're kind of always, this is what anxiety looks like. They're always on that kind of alert and they never really return to normal. And this is the inadequate response, kind of looks like depression when someone kind of is in that freeze response where they stop responding. Often many of us have a go-to in terms of our allostatic load. So I'd love for you each to think about which of these resonates with you and when does each resonate with you. So what types of stressors do you respond to with that kind of 0 to 60 firing? And what is it that you nowadays are kind of have trouble mustering a response for? Think about the stress triggers for you and your response patterns. When we teach resiliency, the important piece that we talk about is learning how you experience stress before you can learn how to cope with it. So this is the diathesis stress model, which is basically talks about one's inherent abilities to cope with stress. And what it basically says is that one's ability to cope with stress determines whether one is resilient or not. Many people can grow up and experience many adverse experiences, but are able to cope and be resilient. For some people, very low levels of stress put them over and have them experience a very unmanageable allostatic load. The good thing is we can be learning different experiences for stress. A lot of our work follows the work that we do clinically of Dr. Herbert Benson, who unfortunately passed away a year or two ago, who had coined the relaxation response. The relaxation response is a physiological state in which one is able to elicit a calming, so a readiness to be able to cope with stress. What Dr. Benson posited was that individuals could train to put themselves outside of the stress response. So this is one's response to stress. Typically, when one experiences stress, they have an increase in adrenaline, heart rate, blood pressure, breathing and muscle tension, and concentration difficulties. And when one experiences the relaxation response, they have a downregulation of that. And what Dr. Benson posited is that we could all put ourselves in the relaxation response. So this is the treatment program that we use. It's called the SMART training, stress management and resiliency training. We teach individuals ways to elicit a relaxation response through meditation and deep breathing, progressive muscle relaxation. We use cognitive behavioral therapy strategies to teach one to identify stress. And we use positive psychology strategies like leveraging creativity, humor, and purposive thinking to be able to cope better with stress. What we're hoping is that in doing so, individuals learn to manage their stress better, learn adaptive strategies, and become more resilient. And in turn, when individuals become more resilient, they're better able to handle stressors. I'm going to go through the model underpinnings right now for the sake of time. I'm going to just do a couple of exercises and give you examples. And if you want to close your eyes and participate, that would be great. The first one is called the single pointed focus. The single pointed focus is just focusing your attention on one or two things. It could be a phrase, it could be an image, it can be a bodily sensation. But the single pointed focus that I always start with is saying just this. So what we teach individuals to do, and you're welcome to close your eyes, is spend a few moments focusing on your breath, looking at the speed of your breath, feeling the characteristics of your breath. Is it warm? Is it cold? And listening to the sound of your breath. As you continue to breathe, focusing on the different sensations of the breath, you should feel a natural slowing down. Observe the timing of your breath, the temperature, and the noise. Continue to focus on the sensations. And on the in-breath, say to yourself, just. And on the out-breath, this. And I'll give you a few moments to repeat that to yourself and to slow your breaths. Just on the in-breath and this on the out-breath. I ask you to slowly open your eyes again, look at the picture, and think about what that felt. Just took a few seconds. We call those mini relaxation response exercises. People can infuse them during the day. You're just taking a moment to take accountability for yourself, your feelings. And in taking a pause, it's protecting oneself against a stress response or reacting to stress. It takes 30 seconds to feel grounded and just be more in touch with how you're feeling. One of the concepts we work with in terms of adaptive strategies is acceptance. And in coping with an illness, as all of you have, this is a strategy that can be very helpful, but is often associated with kind of surrendering or giving up. But we try to emphasize the importance of acceptance as a positive thing. It's actually an accurate assessment of the situation in which one can learn from and benefit from, being able to accept whatever it is. So some questions we ask people when they're debating about acceptance, whether it's about the next treatment or treatment responsiveness, it's how do I accept this situation? How can I come to grasp it? How do I come to the point of not problem solving, but I just accept it as is so that it can move on to coping? Another question with acceptance is, what can I learn from this situation? When one stops trying to problem solve and pivot and sits with the situation in terms of acceptance, they can often look at benefits, look at lessons learned, prepare better. How might I be loving in this situation? Many of you in coping with your illness have also been along this journey with friends and family who loved you. And in accepting something about your treatment or your course, you can ask yourself, how might I be loving in this situation? Loving to those who are loving to me. The last thing I talk about is also an adaptive strategy called social support. And the reason social support is particularly important for you all is that oftentimes one's support changes when they are undergoing an illness or illness treatment. Just want to give a quick overview of the types of support, and then I'm going to pass the baton along to Areej. Emotional support is support that makes you feel loved. There's informational support, thinking about where you get information from, particularly about medical care or resources. Tangible support is someone to give you a ride to the clinic, bring you things. Self-esteem is affirmational support, someone who makes you feel respected, helps you feel, understand how well you are managing a certain course of your treatment. And belonging support, a community, either a pre-existing community or one you developed after your illness. And an exercise that we do, and in closing, I'd like you to think about your different types of supports. Draw a picture of yourself and an arrow in terms of where your support is coming or going. Is that support at this time in your life, at this time in your illness, something that's working for you? We do have a program at MGH that might be relevant to some of you individuals, to some individuals. And I'm going to pass the baton along to Dr. El-Jawahri.
Thank you so much, Dr. Parks. And I'm going to share my screen with you all. So I'm going to try to transition for us and talk a little bit about sort of more regular applications. I'm going to start here and start sharing my screen. So my hope is to really kind of focus on leveraging how we can leverage digital health to address coping with serious illness and managing stress. I'm an oncologist as you heard, and I care for patients with blood cancers clinically and do stem cell transplantation for a lot of hematological malignancies, as well as benign and more hematological conditions in general, including bone marrow failure syndrome. So a lot of the work here is colored by some of the work that we're doing in helping our transplant survivors who've gone through stem cell transplant and trying to support them throughout the illness course. So my hope today is to kind of talk about why do we choose digital health to support patients with serious illness and their families. And I'm going to kind of try to give you a really quick cross-sectional view of some of the work that we're doing, leveraging digital health to help patients with serious illness really throughout the continuum of illness, from the time of diagnosis, the acute phase of illness, if you will, to help caregivers help better support patients with serious illness, as well as into the survivorship phase of illness. And then I'll spend a little bit of time discussing future directions. So the first question is, why digital health? We know that patients with serious illness and their caregivers experience substantial emotional distress. And there are a lot of psychological and educational programs that are out there that have been promising that often require mental health clinicians or supportive care clinicians, such as psychologists, psychiatrists, palliative care clinicians, social workers, to really integrate within clinical care. The problem is we don't have enough resources, we don't have enough workforce to really meet the needs of all patients with serious illness and their families across the globe. We should also note that we know that I always say that any patient with cancer to go through a journey of cancer with a therapist, with a psychologist by their side, they're better off. And at the same time, we simply do not have that workforce to meet those demands. So we really need to think about digital health as a way to scale and disseminate successful programs that we know can help patients and families, and allows us to really leverage digital technology as a venue to really scale and disseminate. So I won't have time to kind of walk you through all the different digital health interventions that we're working on, but I'm going to give you a flavor of them. And I'm putting them here in various categories. One that's focused on the acute phase of illness. This is the time of diagnosis, for example, of cancer in the context of cancer, the time of acute preparation for stem cell transplant for those going through stem cell transplant. We have interventions that are focused more on the survivorship space. I'm going to give you a little flavor of that. We also have, to Dr. Park's point about the importance of social support. How do we help family caregivers, friends and loved ones of those who are going through a serious illness? Because we know helping them can not only improve their outcomes, but the outcomes of patients. And even for our patients who are less fortunate, who are actually dying from their illness, there is a potential role for digital health interventions to really help them. I won't focus on that piece so much today, but just to kind of think about this as a spectrum, and how do we think about ways to leverage technology to support our patients and families. So I'm going to start with a story. I want you guys to meet Jane. Jane is a 38-year-old high school teacher who initially felt some fatigue and a little bit of shortness of breath, mostly when she goes up a flight of stairs or two. She's otherwise very, very healthy. And she presented to her primary care doctor, who told her she probably was working a little bit too hard, and did some blood work, and said, I'll call you tomorrow, the next day, and we'll figure out if this is your thyroid or something else going on. At 8 p.m. that night, Jane received a call from her primary care doctor saying, hey, your blood counts look really abnormal. It looks like you may have leukemia. You need to go directly to the Mass General emergency room, and you need to really be admitted to the hospital. And hey, by the way, you'll be starting chemotherapy within the next 24 hours. And oh, we forgot to tell you, this will be about a 4 to 6 week hospitalization. And this is just the beginning of a very traumatic, a long journey for Jane. And while Jane doesn't have bone marrow failure syndromes, a lot of what we see in our patients is this initial shock of acute diagnosis. There's something really, really traumatic about this presentation that's why I'm kind of focusing on this and really double-clicking on it as a way for us to think about how do we help manage that stress, that acute stress of the acute phase of illness, if you will. So starting with Dreamland, which is one of our digital health interventions that's focused on patients with acute leukemia. For those of you who don't know a whole lot about acute leukemia, this is a fairly sudden, the story of Jane is the story of many, many, many patients with acute leukemia. They get diagnosed very acutely. The most common way they find out about it is over the phone, and they are required to actually kind of go into the hospital to receive intensive chemotherapy. It's a very overwhelming time, as you may imagine, at the time of diagnosis. And within the first 48 hours, and this is true actually for many serious illness, not just leukemia, there's a lot of information that is thrown at patients and families. It's really hard to process that information quickly. And so we know this population has a lot of physical and emotional or psychological symptoms related to this acute onset of illness and treatment, the uncertainty about what the world is going to bring and the prognosis. And on top of it, layer on top of it, the social isolation and loss of independence that patients experience during that long, month-long, 6-week hospitalization. We know actually in oncology, this is the most traumatic diagnosis and treatment course. So there is a real need to address that sort of acute phase, if you will. Now, why do we think about a digital app in this population? Well, these are patients who are stuck during a prolonged hospital stay with virtually no control over their current situation. We hear from patients and families all the time that in the context of feeling so out of control, they would love to be able to do something to give them a sense of agency back, to help them address that acute situation. This is also a very patient-centered approach to dictating pace and flow of information, similar to Dreamland when we think about stem cell transplant hospitalization, a patient spending a month in the hospital. You could imagine that instead of trying to give patients all the information about stem cell transplant the day before they come in, this allows patients to process information day by day. So maybe first week we give them information focused on sort of the acute illness piece, and then the first week, and then the second week we focus on what happens during the second week. This also happened to be a younger population. These are the components of Dreamland. The digital app that I'm going to show you, it has a lot of supportive psychotherapy that addresses that initial shock of diagnosis, educating patients about the illness course and what to expect day to day into the hospital, and some basic effective coping strategies and self-care during the hospital stay. Dreamland is set up, these are some screenshots from Dreamland, is set up in sort of a cartoony setting, in a natural setting outside of the hospital environment to give people an escape. You'll see that all the content is set up as modules that align with their illness course. So for example, week 1 is focused on sort of introduction about acute leukemia and just getting a general understanding of the illness and the basic emotions that people may have at the time of the diagnosis. The ultimate destination is to get home. Patients can personalize this, choose their own avatar. They have a guide that they meet, and that guide is there throughout the hospital stay to help address their concerns and talks to them through these text bubbles that provide text as well as audio presentations. You can see here there's a roadmap that we give patients for the hospital stay. This is one of the most favorite things that patients love about this because it kind of orients them to what to expect during hospitalization. When you click on this, you get more information from patients telling their stories about how they dealt with that particular time period. And there's some gamifications and exercises that are incorporated in this just to help with engagement. So it's not a passive one-way street of information. We try to reinforce this information through some simple games, simple exercises that get people to be thinking and reinforce the learning. Another very popular aspect of this app is just the patient stories. So we have actual patients who've gone through this experience, reflect on the experience. Again, a lot of these are the games that I kind of talked to you about, exercises that reinforce the learning that we talked about. There's a lot of mindfulness to Dr. Park's talk that's focused on helping patients just really reinforce mindfulness as an emotion-focused coping strategy during hospitalization. I won't spend a lot of time showing you the results, but nonetheless, when we did this in a randomized trial, we were able to show that this intervention, this digital health intervention, can really improve a wide range of outcomes, including quality of life, anxiety, depression for these patients acutely during hospitalization for that initial phase of illness. But I'll share with you a couple of quotes from patients who've actually participated in this study. So the first person said, "I don't know how my wife and I could have gotten through this admission without Dreamland. This was the most difficult time of our lives. When I signed up for the study, I never thought this app will be so important to me. I use the meditation exercise every night to fall asleep." The second patient said, "I was reading a lot of wrong information on the internet. I needed to know what to expect. It was helpful to have a credible source of information." So you can see that both of these patients actually found different aspects of Dreamland that are really appealing to them. One felt like they needed that credible source of information and teaching and education about their illness. The other really felt really connected to the emotional content that's focused on helping them cope and deal with all of this. So just to highlight that a lot of times, a lot of our interventions are multimodal, meaning they include various components to really try to address patients' needs. And not every aspect, not every component is going to resonate with everyone. But if most components resonate with people, we're actually able to make a difference. So that was a quick snapshot of this. I want to give you a snapshot of some of our caregiver work. We focused on sort of the acute phase of illness with Dreamland, but it's really important to note, as Dr. Parks mentioned, that these type of illnesses affect not just patients, but their entire families. As I said, I'm a stem cell transplant doctor, and I've seen this over and over again. Social support is critical to get patients through a tough treatment like stem cell transplant. But I've also witnessed that our caregivers of patients going through stem cell transplant have a huge caregiving burden. They struggle with how to best support their loved ones. And it's really important to acknowledge that if we address the needs of caregivers, we can improve both patient and caregiver outcomes. So it's also important to say that caregivers are also really overwhelmed, and we're asking them to do a whole lot. They're trying to coordinate care for patients, bringing them to appointments, managing medications, and managing life responsibilities, taking care of the children if applicable, going to work, worried about the finances. So they often do not have additional time for additional appointments that are focused on them and their care. So I'm going to tell you a little bit about BMT Care. BMT Care was actually an intervention that we developed with input from our psychology colleagues and social workers who care for caregivers of patients going through stem cell transplant. We tried to kind of create a curriculum, if you will, an 8-week curriculum that's focused on helping caregivers understand the transplant process and really providing them with adequate support. And what we showed in a pilot study, that having these caregivers meet with a social worker and a psychologist on regular basis to discuss these different components of care improved a wide range of caregiver outcomes: their quality of life, their caregiver burden, distress, coping, and self-efficacy. But one of the main feedback we got from caregivers was, "This is great. I just literally don't have an additional hour a day to give to be able to attend these visits with these wonderful psychologists and social workers." So the main barrier to really getting caregivers to engage with the intervention was time. And so this is part of the reason why we thought about translating this to a digital app. We took that caregiver intervention and adapted it to a digital application. It's a great modality to ensure scalability, so we're able to actually get the caregivers the content. But it also built on this idea that caregivers now can engage with this when they can. It doesn't feel like I have to block an hour out of my day. I can do it at 10 minutes, between appointments. I can do it right before going to bed, whatever it is, but I can get through it at my own pace and time. So I'm going to show you a couple of screenshots from the caregiver app, just to also show you that, there's a lot of growth and learning that occurs in the context of building digital health interventions. So I personally think this looks better than our Dreamland app. Dreamland app is very cartoony looking. For some patients, it may feel like, gosh, I'm going through something serious. Do I really want to play a game? This doesn't feel like a game at all. Again, it's set up as a journey. It still allows caregivers to kind of do these brief modules that take about 15 minutes to complete, with the ultimate destination of going home and being home with their loved one after stem cell transplant. This is Dr. Jacobs, one of our psychologists who works closely with me and Dr. Park. I partnered with her in building this, but the guide is a realistic person. Dr. Jacobs is actually featured in the app, so caregivers can actually build a relationship with this guide and the psychologist. Again, there's a roadmap that we provide to caregivers. Dr. Jacobs really guides patients through some of the psychological techniques that we think about in terms of understanding how our thoughts affects our feelings and behaviors. And we still have these simple exercises to reinforce the learning, but are set up in nicer graphics, nicer design, nicer escape from the hospital setting. So we have a lot of communication content related to this idea of how do you ask for support, how do you communicate with your, with patients who are going through a hard time. And this is actually sort of active engaging content, so the caregiver can click the answer and vary their communication style and see how the response would be. And there's again acceptance and mindfulness based interventions in there as well. So I think with that, I mean, you're kind of getting a flavor of this. I'm going to give you sort of another application of this work in the context of addressing an issue in the survivorship phase. So sexual health, for example, really difficult topic, difficult to address in cancer survivors and stem cell transplant survivors. Patients feel uncomfortable bringing it up with their clinicians. Clinicians feel uncomfortable bringing it up with the patients. And as a result, it negatively impacts quality of life. And ultimately, what it leads to is we're just really not addressing it. Similar to the caregiver work, what we did is we developed an intervention first that was really in person to figure out how to talk about sexual health issues and then address the needs of patients going through stem cell transplant in the survivorship phase. And we actually showed it with that in-person intervention that we can move the needle. When you took patients who've gone through the intervention pre-transplant, about a third of them were not sexually active, and that dropped to about 6% post-intervention. So we took the lessons learned from that in-person intervention and created a digital health solution. I probably don't need to spend a whole lot of time telling you why digital health solution in the context of sexual health is especially. A lot of the content here is stuff that patients want to do in the privacy of their own home. They may want to discuss with their partners. So it's a really great topic to address with a digital health solution. But there are real biological issues that patients struggle with from a sexual health perspective that we need to address first. So this is an example of a hybrid intervention where the patient meets with a clinician that tries to address the sexual health issues that are biologically based, and then really kind of treat any vaginal dryness, treat any biological issues that we can treat, and then really give the patient the app and say to them, I'd like you to engage with this app. I'd like you to do the intimacy exercises here because I think they'll help with your sexual recovery. So this is our the Shift app, Sexual Health and Intimacy Following Transplant. You can see this has a very different flavor. It's set up as a home environment, if you will. And then again, there are various modules. Each one of these modules in each one of these rooms takes about 15 minutes to complete. You can choose your avatar. You can choose your partner's avatar. You don't have to have a partner to participate in this. And we really address a comprehensive view of the causes of sexual dysfunction here. You can see a lot of that same exercises to get people to be engaged with the content. I promise I will keep this PG-13, so I'm not going to show you a whole lot here, but nonetheless, you kind of get the idea. There's a lot of communication. How do I talk to my clinician about sexual health? There are a lot of exercises that are focused on dealing with the most difficult things that people struggle with on a sexual health front. There are exercises that are focused on pleasure mapping, really comprehensive overview of the issues that can affect sexuality and how do we address them. And then there are a lot of really intimacy-based exercises that are built in the app, and they're set up for all different type of couples or non-couples. So you get a flavor of what I'm talking about. I think in terms of future direction, we really need the power of digital health is really leveraging it to develop more population-specific resources. You know, an app that's directed to patients with acute leukemia can really speak to that population, for example. An app that's directed towards transplant survivors who have sexual health issues can really speak to that population. So you can imagine we can adapt these to really address the needs of many patients with serious illness, but tailoring it to that population is really important. I fully acknowledge that digital health is not for everyone, but if we can think about hybrid interventions where we incorporate clinicians plus a digital solution that that may actually increase, and that may work for most people. And it'll also allow us to really increase our sort of health literacy around digital health intervention. If you have a clinician who's engaging with you through the digital platform, as well as in person or over telehealth. And we have to ask the question, how do we enhance engagement in these type of digital interventions? How do we scale successful interventions? One of the pathways we are proceeding down is really getting FDA approval for these, so that a clinician, a doctor, could actually prescribe one of these apps for patients during the survivorship phase to address their issues. With that, I'm going to stop, and we're happy to take questions and comments from you. Thank you all for listening.
Thank you. We do have a few questions, and we encourage the online participants to submit additional questions also. One question is, can patients access Dreamland, or are there other apps that you would recommend if that's not available for them?
Absolutely. You are welcome to contact me. We are actually doing a very large study now to get Dreamland to be FDA approved, so that, again, a leukemia doctor can actually prescribe it to a patient. But if you want access to it outside of the clinical trial, you're more certainly can have access to it. I'm happy to provide you access to it. So Alice, you feel free to provide my email address to folks, and I'm happy to, would love to get your feedback on it too.
Thank you. One of the questions that we receive frequently here at AMDS, and it comes up in support groups, is just the dealing with the uncertainty of bone marrow failure, both, of course, at the acute level, but also as a chronic disease that, people have their ups and downs, and they may not look ill in any way, or they may be functioning pretty normally to people who interact with them. But this is for both of you, how do you suggest, in addition to what you've talked about in the webinar, particularly how to deal with the feelings of uncertainty that surround these diseases?
Dr. Park, I feel like you got to start with that one.
So yeah, it's a great question. And I think that you raised two really important words for kind of acute and chronic. And ironically, the tools are the same, but a lot of the focus to which patients and family members get support is during the acute period. And so I think what's really important is to really think about the chronic period, because oftentimes that's when they get less formal support. They're interacting less with medical professionals who provide a lot of support. So oftentimes the uncertainty really starts to weigh patients and families down after the acute period, which seems counteractive, because you'd think during the acute period, you're waiting for daily updates, you're getting test results, but actually it's the uncertainty, as you had said, of kind of how things are going to be going long-term, day to day. So the skills really for the chronic uncertainty is what we had talked about, is really understanding how you cope with stress and understanding some skills and some acceptance that that is your normal, and developing a sense of mastery. I found that many of my patients are actually quite skilled in uncertainty, as I had said earlier on. So I think that patients themselves, once they step back and accept that path of uncertainty, will be surprised to observe that they have a lot of skills in coping with it.
Thank you. Dr. El-Jawahri, do you have anything to add to that?
Yeah, I mean, I completely agree. I think when we are facing an acute stressor, and there are clear next steps as to what to do, right? That you can mobilize, and you could be working on, meeting with your doctors, coming up with a stem cell transplant plan, prepping your family for it, packing your bags. It's easy to focus on these practical aspects related to managing the illness, going through treatment. And really, I find, and I often actually tell patients about this ahead of time, that once that period passes is when people struggle the most. And they struggle the most because they don't have practical things to focus on, and they can actually process what they've gone through emotionally. And they struggle with the uncertainty of what will happen next and not knowing what the future holds. And I do think, one of the main things that I've learned at least from practicing clinically, and I hope that's supported by data, Dr. Park, is a lot of what I feel like helps patients is acknowledging and normalizing that this is a normal part of this experience, that uncertainty is hard for anyone in any aspect of life, and that anybody who's going through this can feel a range of emotions related to that uncertainty. And sometimes normalizing that can go a long way into helping patients at least kind of calm down a little bit about it, and also not psychopathologizing it. So I think it's important to note that a lot of that is just normal of living with a serious illness and having to deal with the ups and downs of it. And a lot of the things that we have to do in terms of effective coping strategies that work in our other stressors in life totally apply here, right? That the things that have helped you cope and deal with difficult things in life before probably are the same things that will help you cope and deal with difficult things surrounding uncertainty related to illness, whether it's faith, whether it's spirituality, whether it's distraction, whether it's whether it's talking to someone about it. All of these coping strategies are really key, and they become really important. And the last thing I'd say about this is, I think the people who deal the best with uncertainty that I've seen clinically are people who are able to diversify their coping strategies. So if you are a runner and all you do when you're stressed is run, and gosh, you just went through a transplant and you can't run, your coping system around the uncertainty of transplant falls apart, right? And so diversifying your coping strategies and thinking about innovative and different ways on how to cope with stress, I think can help get through these difficult times.
Thank you.
There's a lot of questions in the app about in the text about Areej's app. I'll let her address that. I just wanted to address quickly, it's a bit of a different flavor, if I may, Susan's comment about people asking how can I help and what to do with their husband's illness. I'm just going to tie it back to that support. One of the things we work on a lot in our programs is how to ask and normalize asking for help. People do not know what to do and they want to help. So if you think of those different types of support, what kind of support do you need help with? Emotional, affirmational, informational, tangible. What do you need help with? And how are you directed with people saying, as Susan said, sometimes we don't know, saying, we don't know right now, but can you call us in a month? Or what is it that you could do? Any suggestions of how you could help? Or being honest, like, you know what, it would really be nice to have someone do the driving on Thursday night. So part of it is feeling comfortable asking, reviewing the types of support and understanding what you need, and then also encouraging people to check back in. People want to help, they don't know what to do.
And we have a few other questions here that we have not yet addressed. One question is also about the app as to why do you need FDA approval?
That's a great question. And I honestly struggle with that answer, but I'll tell you the short version is, the reality is you probably don't, right? You probably don't need FDA approval in terms of creating an app that works. And you're right, this is not a high risk intervention. The reason for FDA approval or seeking FDA approval is more related to scalability and dissemination in the United States. So if the FDA approves a product, then insurance and Medicare will consider paying for that product. And I would love to be able to say a clinician can prescribe a digital therapeutic for a patient and a patient doesn't have to pay for it, and ultimately have the capacity to get all patients with serious illness access to these apps.
And there are some questions too about the, I guess the confidentiality of the responses.
Yeah, so really we do, we don't ask patients, it's a great question. There are some apps that ask patients to input information, for example, symptom monitoring, your pain levels, all of those things. In a lot of our apps, we actually don't do that. We don't ask patients to report information, but it is all confidential. This is obviously, at least in the context of trials to begin with, is incredibly regulated. And so we don't monitor what buttons patients press or what content they go into. We like to get a sense of how much of the app they completed and how much of the modules they completed. More to the question that was asked in the chat about, how do we know something is successful? We look and see, well, gosh, module 2 was a hit. Everybody got through all the module. We get feedback, iterative feedback from patients and families about these apps to make them better. And so we monitor module completion and module access, but not the actual content that patients go through.
Thank you. And I think this will be our last question unless others come through in the meantime. What would be your guidance for patients and or caregivers finding a therapist who can address their needs? How either in a clinical setting, what questions to ask or how to bring it up with their healthcare team, or just in general, if they're doing a search looking for a therapist. Do you have any guidance for how they should go about doing that and finding someone that's appropriate for their situation?
Yeah, I was putting a note in the chat and I actually have to run because I'm a patient. I think it's such an important question. And Dr. El-Jawahri and I actually have a program where we're intervening with caregivers and patients together in separate groups, because the caregivers often don't ask for help or don't know how to. So the one thing is just normalizing it. It helps the patient if the caregivers get help. And because the caregivers sometimes outside of the system, asking the caregiver's primary care, really going to the caregiver's care team and asking for referrals is very helpful. And or you could ask for referrals within your patient's care team.
Thank you. And I see no further questions. I do want to clarify with everyone on the call. We'll send the contact information for those who are interested in the app. We typed it in some of the responses, but we'll send it in a follow-up email for everyone for those who are interested. And I don't see any other questions coming through. So thank you so much, Dr. Park and Dr. El-Jawahri, for sharing your time and expertise with us, especially during this very challenging time. If you would like to watch this webinar again at a later time, it will be available on our website within 2 to 3 business days. If we were not able to answer your question today, you can send it to us at any time in 3 ways. You can send an email to help@aamds.org. You can call our helpline at 800-747-2820, extension 2, or you can submit a question on our Facebook page. On behalf of the Aplastic Anemia and MDS International Foundation, thank you for joining us today and for making us your resource of choice for information on bone marrow failure diseases. The AAMDSIF Medical Advisory Board and team are here to help you and your family as we have for the past 39 years. This concludes today's program.
Thank you.
Thank you.